Kern Valley Healthcare Board of Directors meeting to order at 2:01. And looking for the approval of agenda. If there were any questions or not, if not, everybody in favor say aye.
Aye.
Oh, you can do a motion.
You have to have a motion in a second.
You guys were like, okay,
Like the motion?
would you?
I'd be glad to.
Okay, thank you.
Yes.
I'll second.
Second. But
Yeah,
those
we
are
can aye.
quiet. Everybody in aye, say aye.
Aye.
In agreement? Perfect, thank you.
God.
See, we could have gotten away with it if we'd started early.
Yeah, that probably would have been the only thing. John, you'll do the flag salute.
Yes, ma'am. Please place your right hand over your heart. If you're active or former military, you can salute. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
If you would remain standing, join me for the invocation, please. Lord, I just want to take this time and come before you, and I just ask that you continue to be with all of us that sit on the board and those that join in this meeting, Lord, and that we do your will for the community, for the hospital, Lord, that we honor you as we do the work for the hospital. I also would like to take the time to be with those that are in turmoil in this world, Lord. We know that there is turmoil in many, many places, Lord, and I just ask that that we be protected from turmoil like that as we do the many decisions we have to do to make this hospital run. I just ask all these things in your name. Amen. Thanks. Next is the mission statement. Do we have anybody from the public? I don't think so, but the mission statement is we will provide high quality, efficient patient care services that respond to the community and provider needs. We will provide leadership and health promotion and education for our patients, residents, medical staff, and employees and community throughout the district.
What does that mean?
What does that mean? It means that everything I just prayed for is going to happen. And I can continue to educate you on that afterwards if you would like it. Or Scott can, he's here. And again, for public comment, I didn't see anybody here for public comment. So if there is somebody, this has been posted to public comment. So I'm not going to be reading that at this time. And the next one is the consent agenda. The following items are considered routine and non-controversial by hospital staff. Consent items are listed as action items and may be approved by one motion. If no member of the board or audience wishes to comment or ask questions, if comment or discussion is desired, the item will be removed from the consent agenda and will be considered separately. So has everybody reviewed those?
On the building and planning, talking about FEMA grant. And,
So you want to take that off?
Do you want to remove
Consent?
that?
yeah, I'd like to talk about that.
Okay, so that's number 4. The building and planning minutes, we're going to remove that and we can move that to new business as item 1 in G. And if there's no other discussion, if I can have movement for a second, a first and second, sorry.
Move to approve the consent agenda minus the building and planning meeting.
Thank you, John.
I'll second.
Thank you very much, Ross. And all in favor say aye.
Aye.
That was 5 of them, so we're good to go. Um. Yeah, it's all on the consent. I was
Yeah.
just looking about that one thing that I should have talked about that. Okay, so we are going to go to E, which are the reports.
Had a meeting with the hospital CEOs last night from Kern County, with the hospital council. Spoke about a couple of the bills. One was this new bill that's supposed to be looking at the Office of Healthcare Affordability. And they basically established, this takes effect in 2025. And they basically established a 3.5% target. At this point in time, they're not sure whether or not the state is actually going to impose any penalties if you don't hit that 3.5% threshold
What, 3.5% of what?
cost.
I
So
don't understand.
they're trying to limit the cost of providing healthcare is what they're doing.
Okay.
And so I've got to go back after our meeting last night. I want to go back and relook at the bill again. That is going to, each year going to taper down to get down to 3% as their plan. And so.
So we can't raise our prices more than,
Well, that was kind of what they were saying. They were talking about it from a revenue perspective as well. Then one of the things they threw in was that apparently any seismic work that is done is going to count towards that total. And we're like, wait a second, how the heck are you going to make that?
we'll be good for 20 years or so.
Well, and then, then we threw in the fact that, again, these mandated minimum wage adjustments that we're going to get every year for the next 10 years. We're going, how do you sell on a 3.5% for the first year? When the cost of healthcare in the state of California is currently running about 4.69%. And so they're going like, and they don't care. They just said, you're gonna hit this. And the interesting thing is that they shared that this has been implemented in a number of states throughout the country. And there's only been one case where a hospital actually got fined. And that was millions and millions of dollars and so forth. And it wasn't because of the hospital not hitting its targets, because a medical group affiliated also, they didn't hit their target. And so, so there's still a lot of questions about how this whole thing is supposed to work. And this was a mandate from the legislature, which the governor signed.
Is that rated per person, or is it the hospital that just the overall revenue, or?
Overall is what we're understanding. Yes.
Okay, then.
But this also applies, it's not just the hospitals, it affects the doctors, it affects clinics,
We
everybody.
get some major help from AI. I know you're tired of hearing me say.
Yeah, no. I sent you an article the other day on what's going on for healthcare with AI. So, yeah, it's got a lot of people frustrated right now, and I'm sure there's going to be a lot more that comes out in the very near future on this stuff. But like I said, at this point, we know there's should not be any financial penalties through 2025, and we'll have to see where things go from there. We also talked about the seismic bill. The state basically is looking to add at least another 3 more years. This is kind of what they're in discussion with right now with CHA. And then potentially an additional 5 years beyond that if the cost issues come into play. And if the hospitals basically claim that they don't have the monies to get this thing done within that 5-year period, then the state will come in and the state will audit the costs of the project and so forth in the hospital's financial position at that point in time. And then basically if it shows, because their concern is that the bids on the project are going to be sky high. And they said, this isn't necessary that you do all this stuff. They're going to come back and tell you that this isn't necessary. So and they said at that point in time, if it's ultimately determined that, yeah, those are actual costs to do the construction, and this is the hospital's financial position, then they will waive the time to get this done indefinitely until the state can come up with the money to pay for it. And so, as I said, I think I've been hearing from a number of facilities that right now that are basically taking a chance and saying, there's no way we'll ever have the funds to do this. And so we're not going to do anything. And these are some of the facilities in Bakersfield. So they're just saying, hey, they're not going to shut us down. They can't afford to. So risky proposition, to say the least, but see where that comes from.
That's since Catherine's been president.
Right,
Yeah.
that's,
That is so cool.
That's what I was thinking. I am now running this three-ring circus.
Welcome to California.
Yeah, and do these people even talk to each other before they each come up with their own ideas? I'm gonna say no, but
I don't know who's up there making decisions.
That's really good news. We're not going to be under pressure. We can do it as we go along and as we earn money.
Yeah, if they're coming up with the money, that'd be great. SB 43, this is the efforts to change the 5150 definition in the state of California. Basically, the way it was described to us, this will be disastrous for the hospitals.
Yeah, because they're gonna put the onus on the
The
hospital.
onus could be all put on the hospitals. Vaccines. And so yeah, and
And of course, can't raise rates more than 3.5%.
I don't know how you're supposed to get anything done.
And you have to provide one-to-one coverage for all those.
Yes, you do, because most of them, they're increasing the requirements to include behavioral health issues and so forth, above and beyond what's currently in there.
So can we buy college community services and just put that section down there?
hire more psych techs.
Yeah, like something. But anyway, yeah, so it wasn't news for a lot of folks last night. But I think everybody felt like, hey, we're in the same boat. We're gonna have to do what we have to do. You know, we'll figure this out as we go along, but there's gonna be a lot of heat because this is a statewide issue coming up. Yes.
So does that mean that they're changing? Like if we can have a patient that's a 5150, we're no longer transferring them to a psych facility that we have to care for them ourselves.
Yes, if that is available to psych facility, yeah, you can certainly transfer.
But we have to
Issue.
care for them in the meantime.
Yes, so you can make that happen.
That's no different than what we're doing now.
Pretty much is, I mean, really. But,
Yeah, nothing changes.
so,
Just make it sound worse.
oh, it
We
is.
need a new transportation driver with a new job code.
Well, technically, you know, they said there's basically 2 facilities down in Bakersfield right now that can accept the 5150, and that's the new behavioral health
Right.
center that they just opened.
Did they
And
build
then
it?
current medical. Yeah.
Is it done?
Yeah.
Okay, good.
So,
And the one in Ridgecrest?
well, they're not accepting overnight stuff from what I understand.
It's just a 24-hour or less
Right,
facility.
right. So,
You don't have bed space there.
right. So anyway, they're
Good
just.
news all around.
Yeah. Just love healthcare. The CFO interviews, I've had one interview, obviously, that went very, very well. Gene, I appreciate you coming.
Yeah, we've been waiting to hear something.
Yeah, well, I've got one other candidate that came in like the next day after you interviewed him.
Great.
And he's relatively local. And he has some critical access hospital experience. Like I said, John, I think probably has more usable experience at this point in time, but I said I would interview, I'm interviewing him on Monday.
As long as he works for nothing, that John, he's good.
And so, anyway, so I did talk to this gentleman, yesterday that, was interested. And so, he will be, coming out and meet with us and stuff like that. So, but yeah, and he's aware it's part-time position type thing and so forth. So, we will, see, I've got a couple of people that I work with regularly that he's put down for, referrals and so forth. So I'll give them a call.
We're gonna get some help.
Yeah,
I'm glad we got a couple candidates.
yeah, good quality people.
Great.
They're real well.
Tim, you said that this next candidate was relatively local, like out of Bakersfield. Okay.
Yeah. Say true.
Okay, I was just curious, like how
Yeah.
local, okay.
Yeah, and.
Codfish.
Oh, it's possible in Boston, really.
And let me see, the minimum, we're getting ready to do the minimum wage adjustments, that we put in place. Those will go into effect the week of, well, actually, we were gonna put them in effect the week of May 19. We did find out our system will allow us to go ahead and do those the day before June 1st. So we literally can keep the rates where they're at until that kicks in. And so, and again, that worked out to about a 2.4% increase.
Okay.
Payroll, which all things considered what we were looking at before, I feel pretty good that we can get it with that for that. We had our exits. Yes.
Well, because like, so I know that the minimum wage is going up. So what does that mean for our long-term employees?
Doesn't matter, but it's based upon what you're getting paid. There are adjustments to the pay, not to seniority or anything like that. So,
So if I already have some.
but if you're a more senior person, more than likely you're already making more. So, you know, again, things will shift up from there. So. It's
There
not
will
all
be
the way.
increases for the older.
The lower end employees obviously get the biggest increase. Yes.
Right.
So, which is the way it's supposed to work. Because we've got to get them up to
Right, right.
$18 an hour. Right.
But there's some consideration.
Yes.
But this is just an increase to the minimum wage,
Yes.
not to everybody else that's making above. minimum wage.
It affects up to about $30 an hour. Anybody making up to 30. And above that, we've kept them whole because they will be eligible for normal increases that we've got. So our challenge is obviously going to be in coming years, because obviously this is going to go up. We usually budget a 4% salary improvement package that's in the budget. And then what happens is we, that used to be given out twice. Once is for their, the merit piece, and then the other piece was the parity. That was usually done in that last week in November or early December, and so forth. And so our next task is to go back and figure out how we're going to do that other piece, because now, like I said, this is a mandatory increase for us. That's 3.5% in essence of that pool. So if you just take a look at what we did for the lower end to get them up to minimum wage, that was 2.4% of 4%.
So
The
we,
high,
go
I'm
ahead,
sorry,
sorry.
the high inflation, they're still behind from 21.
Yeah.
Are we going to find a way to bring them up?
Well, they're doing that for us. I mean, that's what this is required. So that's why I say we're going from a minimum wage of $16 up to $18. And then that goes up a minimum of 3.5% per year.
So what do you
Okay.
call it, compression or something?
Yeah, we developed a stepping system to kind of absorb some of the compression. I think that's.
So if you're
that's
made
good to see
between
that
16, was it 16 and
16 and 30.
16 and, I mean, do we want to go into,
not too much, just,
it goes up between, if you make 16 and $18 per hour, it's going to be a $2 per hour increase in that range. And then the next tier is like $1.75 up, next tier is $1.50 up, and so on. So as you make more money, the increase goes down
yeah.
to help with that compression effect.
But there are some for the ones that
Yes.
got a decrease in pay over the past 3 years. Effective-
To my knowledge, nobody's got a
Nobody's got an
decrease in
increase.
pay.
They've all.
With inflation, what has their income gone up? 4%? With 9% inflation, they haven't had a decrease?
Well,
The-
comparatively, you're right.
Yeah,
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 you're
right.
right.
In terms of spending power, yeah.
Yeah.
But in terms of
well,
that.
that's what they are.
So, yeah,
They're in the same place we're at.
sure,
I mean,
no question.
But that $2 per hour for the lower end is beyond
That's
9%.
like.
yeah, I know,
So-
I'm
Right,
I'm talking about making the whole hospital where everybody's making fair wage.
This certainly helps a lot.
right.
Well, we're decreasing our reimbursement.
Yeah, right, exactly.
But we're behind in,
And I'll talk about that in a little bit here in a second too. Again, we had our exit survey for the SNF survey. There's approximately 7 minor findings that they had. We're in the process of responding to those plans of correction right now. We have not yet received the life safety survey yet. I think there was 5 or 6 on that one. And so again, they were relatively easy things to fix. Like I said, electric outlet cover was cracked. And so they wrote us up for that. She said, I had to write you up for something, because otherwise they're going to send me back out here again. So it was those kinds of things. So anyway, we're getting all those taken care of, getting back in. I think we've got to next week to get those back. Yes, right. And then we have, like I said, we'll have roughly 10 days after we receive the life safety board to get that back as well. Whitley, again, I had been sharing with you, again, there was a bill that was going forward. It was a CHA sponsored bill that would provide cost-based reimbursement to the rural hospitals, the critical access hospitals. and so forth. And so Whippley was hired by California Hospital Station to do an analysis on each of our hospitals. And in essence, what our survey showed was that there was roughly about a $3 million lag from what our costs are versus what we get paid. Okay, and so, and the district hospitals made out pretty darn good. As a matter of fact, most of them have opted not to get into that legislation at this time. And the reason for that is primarily because we, as a public facility, are eligible for the supplemental payments. The private hospitals are not. And so, and those are the ones that are really hurting financially. So we just get a rate range adjustment. And that's what the state provides us each year to make up the difference between the costs and what we've been reimbursed. And so based on Whippley's analysis and my conversations with Matt Faulkner, I said, Tim, I would stay right where you are. He says, you're doing quite well. He says, because I know our rate range adjustment that we just got several weeks ago was 5.8 million, but we're only 3 million. So he says, for us, it worked out really, really well. And so, and most of the other district hospitals felt the same way, and they've opted out and so forth. And so it is going back for some more. It's passed 14-0 or 11-0, I think, in the Health Committee. It's now going to the Appropriations Committee because they've got to determine what the overall cost to the state is going to be. And so with some of us opting out, that will lower the overall cost that the state would have to kick in order to get those other hospitals monies they need. So
If the IGTs go away, can we opt in at some point in the
that was
future?
exactly, yes,
Okay,
yes. And that was what we wanted to maintain.
okay,
And so, because it's a year by year, opt in, opt out.
okay.
How
And that
would
was-
that be good if we opted out of one, they,
You get to make a new decision the next year.
so every year you can make
Yeah.
a decision.
The way it's been written, yes. So, but right now, like I said, it didn't make sense for us to join in. So, like I said, there'll be some more conversations at appropriations. And the big issue everybody's got right now is even though there's absolute need to do this, like I said, we're upside down 3 million technically on Medi-Cal. The other hospitals that don't get supplemental, they're really upside down.
Right.
And so, so there's certainly a need to do that. The big question is now whether or not the governor will sign it. Primarily because of the financial situation the state's in right now. And so, because they're looking at, even with the districts coming out, they're still looking at about a $75 million hit to the state. So we'll see, whether or not the state feels they can come up with that kind of money. So, and Greg's going to give a report there. I'll save that last piece. I'll let him do that. But yeah, like I said, we're continuing to move things forward and do the best we can.
Okay, thank you.
You're welcome.
And Mark for the Chief Nursing Officer report.
Yeah, we, Tim and I started a walking rounds kind of program at the hospital to be able to walk through different departments and kind of pick on things that are easy, low-hanging fruit to solve. We noticed some pictures that came out through social media of the sink area in the ER. It looked horrible. It was dirty. It was dripping. It was a big mess. So we decided we need to do something about that. So we stepped it up and we decided to go walk through, and the ER was the first place we walked through. And within 2 weeks, we were able to address the leaky faucets, the stains on the sink, the other faucet that wasn't working at all. There was a safety concern in the triage area of an overhanging shelving unit that people were hitting their heads on. So there's little things that we could do to change and just improve our overall appearance, especially in the ER, because that's the point of entry
For most,
and people who are patients in the ER just sit in that one little space. They hear things, they see things, and they take pictures of things. And we are trying to improve our standing in the community. And so I think this we started in the ER with Bob and Cheryl, the housekeeping manager and the maintenance manager, and we developed a punch list of things that we could really quickly and really easily address and fix. Painting the walls where the gurneys are chipping on the side, they run into. And actually Bob replaced some of the, with some stainless steel. So now you won't have that chipping. So it's really, really good feedback. We were able to get the ER done, and now they're working to get a lot of the things on med surge done. And we're going to go to different departments to make sure that we're addressing. I think the next one we may go to is dietary, because they have some real issues in dietary. But I think the overall appearance is going to be better. The morale for the staff is going to be better. I think it's a good thing. We've heard good feedback from the staff, and we've even gotten some anonymous virtual suggestions about, hey, what about my department? So
We'll get there.
we're getting there. From patient safety and beautification perspective, we've already received that valuable feedback. The next thing I wanted to talk about was transportation. We are going to be hiring or we'll be posting at a position that you guys approved for the transportation driver administrative assistant, which we'll get that person on board, and we should be able to use that person to basically get some reimbursement from the insurance companies and plans so that it can start paying for itself a little bit. And that's the goal behind that. That plus a dispatcher person so that they're more available in the community at the drop of a hat. So, hey, I got a prescription I need to get picked up. All right, KJ's already in Kernville. Let's go to the. So that's the kind of thing that we want
On
to
the
do.
transportation for like Liberty ambulance, is there a way, since there's a non-compete with them, to take patients around? Could
We're
we
doing non-emergency.
collaborate with Liberty to where it would be easier for us to bill the insurance companies if we were affiliated with a real medical transportation?
So it's a good question. I don't know the answer, but their emergency medical transportation, they don't do non-emergent. They'll only do a ride home if there's a doctor's order and a medical need.
Okay,
so-
okay, but meanwhile, maybe we could,
I can.
We're
reach out
open to
to
fill up
Liberty
the
to find
different
out
on there, right? Yeah.
see if there's some sort of a,
Yeah.
so we could do the billing legally and force them to pay.
well, everything be legal.
Yeah, well, okay, and I
I think.
couldn't imagine why they wouldn't want to work with us.
So most insurance companies are pretty obligated to give their members certain number of rides to their appointments. You want to say something, Sherry?
Yeah, so wouldn't we have to be like credentialed as a non-medical transport with the specific?
So this is the thing that this person is going to find out before we start billing that. Yes.
Mark, that's like basically the same as if you see an accident, the person's laying there bleeding, you know he's gonna die, you throw him in your car and you drive him down.
So it's a good
You
Samaritan.
can't bill the insurance company.
Right.
We're almost the same thing right now. We're real close. So I don't think we could force.
So
it.
we could help. No, we can't force it, but we could help that person get a claim from their insurance company to pay for that
But if
service.
we could be sort of a sub really the
Liberty, that
without
would be a good
affecting
thought.
them, maybe it would give us enough power to
That's a
make a
good thought.
real transportation deal work.
And I'm hoping that this person that we put in that role can find these things out and get these answers for us. Right now, we're providing that service for free.
Most of the ambulance companies in California don't do that kind of transport anymore because
Right.
there's no money.
Right.
It doesn't pay for itself. So they've given it up. And so there are a bunch of fly-by-night places that do non-emergency transport, usually for cash.
But it could be an opportunity for us to sort of dovetail in there and make it work for us and help them out. Their image.
It is a benefit. It's a benefit on an insurance.
Yes,
Like her family gets it.
yes. Current Health Systems is the one that's pushing us to do this. And so they were the ones that bought our vehicles, and they've given us grant money to pay so far for the drivers and things. And they're wanting us to develop this program to be able to build the insurance for these ride-alongs.
It's an obligation of theirs under Cal-Ames,
Right.
to do that. So
I'll be interested to see your projections, but I doubt if it'll end up paying for itself.
I don't think it will either, but I think that.
But if we can
it's
offset
necessary
the
to have
cost,
it.
yes.
Exactly.
We're a public entity. I think it's a great service. I'm really glad we're doing it, but I don't think it's gonna be a revenue source for us, really.
yeah, if we can just get the costs covered, that would be the best,
Yeah.
of course.
Well, can we use it as Uber at night on
So-
holidays, New Year's Eve?
Just stay out of that.
All right, just,
So on a different note, we do have our infusion pumps here and programmed. Now we've embarked on training for those, for the nurses. The training should be, the video portion of the training will be done by the end of May. Then the company will come out and do their hands-on part, and we'll go live early June. And then after that, the barcode medication administration in the ER will begin. So anytime a medication is delivered, it will be scanned and checked against the order to make sure that it's the right time, right route, right drug, right patient. All that stuff is taken care of. So we saw some really good feedback we've been doing barcode medication administration on MedSurge for a long time, several years, and we've seen a decrease in their medication errors. It's difficult in the ER because you don't always have a real-time order. Usually there's a lot of verbal orders placed in the ER, so that's going to be the roadblock here. So we'll do the best we can. But I think barcode medication administration is going to help just curb some of the errors that do come through. And so Tim, if you want to mention our progress with the surgery department and your talks with, no, we don't want to mention that. Okay, fair enough.
And new information for it.
Okay. We'll leave that one alone.
Okay. We're still working.
And that's my report.
all right. Thanks, Maz. Harry, you're up.
Oh, boy. Me, Mark, and Ben Torres, last week went to a TrueBridge, formerly CSI conference in Las Vegas. So we learned a lot about some of the things that company's got going on, which is what we use for pretty much running the hospital. So a couple exciting things that I think are going to be good for us. There's a new data analytics tool that they developed that will give us really good insight to financials and then some patient related stuff in the future. So that's coming out in September. So a lot of like the reports that we used to see, like financial reports, there's a lot there that we can just drill down like on the spot, get real-time data on all kinds of different lines of service, all of that. That's just kind of at our fingertips. So that's pretty exciting. They didn't really show any of the clinical stuff, but that same idea behind those other analytics are going to be brought to the clinical side too. So that's happening in September. So we'll assess if that's something that we need at the time. I think it could be great. I have a meeting next week actually about a unified patient portal. So right now the hospital has a patient portal that, anybody who visits the hospital, you can get on there, get your records and so on. The clinic does not. Part of the reason we didn't do that was cost. And the other reason was it's very confusing to be like, I go to Kern Valley Hospital. Now there's two portals. Which one do I log into? It's just kind of clumsy. So this would allow us to have one patient portal for anybody that's goes up there, even they're on a separate EHR. So it's a EHR agnostic patient portal. So hopefully that works out. I'm excited to see what they have to offer there. I don't know if Mark, you want to talk about the SDOH tool?
Yeah, the tool that they had for social determinants of health risk assessments for every admission to the hospital. I don't know if you guys are aware, but the state, or actually CMS, the feds have put out basically it's a questionnaire of social determinants in certain people's, admissions. If they're worried about their next meal, if they're worried about homelessness, if they're worried about going home and getting abused, those kinds of questions are being asked. And these are all mandatory questions. The patient doesn't have to answer those questions, but we have to ask them. And then when we see that there's a risk in someone's household of what are we doing to help them understand what resources are available in the community? So the tool that CPSI or TrueBridge has developed is a very user-friendly app that we'll have to pay for it. It comes out in September, but there'll be reports generated as far as identifying how many people in our community are worried about their next meal and what resources we can turn them on to, like food banks and pantries and things like that. Robin has an exhaustive list of discharge planning tools where we can give those out to the people. We just have to show that we're doing that. And this tool that Evident has is going to be very helpful in that role. So more to follow on that. They're also addressing a lot of the nursing concerns. They didn't talk about any AI related stuff.
Can I chime in on this?
You may.
Current health services is doing something very similar. They're mandated to collect this data for their patients as well. They're a lot bigger than us. I wonder if there's some advantage to somehow collaborate with them rather than create our own standalone system.
That
Can we
does not-
piggyback on what they're doing?
No, sir, because their issues don't address local community issues. So they might deal with their own constituents up here, but for the most part, they're dealing on far greater numbers than what we're.
But they're collecting the same data from their patients who we're caring for. Since
don't
they're
know.
doing the same data collection.
Something that we can look into.
And talk to the people down there to find out.
But their data is going to be skewed by their sheer.
I don't mean that overall. I mean, whatever tools they're using
Right.
to collect that data, can we somehow do it once instead of twice? Have them pay for it?
I'll touch on it.
Yeah.
I have no idea what they're using.
I don't either.
So I'll preface it with that, but the data we have for our patients lives inside of our system. So a lot of that information, those prompts, all those things for like a nurse to collect this data, because that's who's going to do it, is already in front of them. They're filling it out. It's going right into our patient chart.
Okay.
So that's one benefit of doing it this way.
Okay.
As you get older, and all the doctors I've gone to, and I just ask everybody and make sure I'm safe and all that. And I told them the only place I'm not safe is our board meetings.
That's true.
And why is that?
So is this gonna, once you put the information in, is it gonna print out a list to give to the person that's being sent home?
I have no idea.
So as far as discharge planning, the discharge plan starts from the
Admission, right?
And Robin is very keyed into understanding the answers, because we're already collecting the data in our own way
Right.
and we're tabulating that manually. Their system, TrueBridge, has a very easy way of pulling the data and understanding the risks and then working on those social determinant risks.
And so at this time, we don't have a brochure or anything like that
We do.
okay,
Yeah, Robin has brochures. She makes contacts with people about home health services, about the food pantries that we have. She talks about getting home health visits and things. So we are addressing the need. And she has all those resources at her disposal.
And we talked about that at IDT this morning.
Yeah.
There was patients that we had some concerns about follow-up therapy and those kinds
but
of things.
she writes it out and hands it to them, pretty much.
I thought she had some flyers.
Yes.
Yeah.
She does have some printouts, because I know at different places, I mean, they may have a trifold and that stuff is already in there.
Right.
And even if it's just the 211 and, different things that we're handing out or we have up on the wall. If they're going to answer you one way, but they're going to take the flyer
Right.
because just because we're asking doesn't mean they're telling us what's really going on.
Right.
But if they have access to, and that's when we're gonna give them the brochures or whatever, is when they're answering the certain questions. But there's a lot of people who are gonna say, no, 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 but they're gonna take the information
Right.
with them.
Good point.
So I mean,
Yeah.
whether it's in the ER, whether it's
Yeah,
in the
private
lobby.
holds that are in the lobby or not, I'll have to look into that.
She may have those hands about it. She's interviewing
Yeah.
staff and stuff.
But like Catherine's saying, if somebody's not willing to
And they're,
embarrass themselves into saying, I can't afford my next meal.
Right.
But
Yeah.
they have a resource available that they'll just grab a hold of and put in their pocket, that
yeah,
there's a pride issue involved for sure, I can see.
yeah, or a safety issue.
Yeah.
If somebody's with them in that, when they're getting their question
Yeah, that's right.
answered, they're gonna answer it one way, but both of the people standing there know it's something
It's
else.
totally safe at home.
Yeah.
But it's not.
Right.
Got it.
So, I mean, just questioning. So, okay,
Moving on.
thank you, sorry.
Welcome. It's okay. We're also working on the same point from that conference is Ben, our clinical informatics coordinator, is working on a more streamlined way for getting admissions out to the floor. So he's working through that. So anything that is more streamlined is better for those. So hopefully that works out okay. We do have a couple open positions, one current in IT and one pending. Unfortunately, Ben, who I've been talking about, is moving to Arkansas for some family stuff. So he's become a very valuable part of the team, both in IT and throughout the hospital. So it's a big bummer to lose him.
That's not been our CNA instructor?
That's the one.
Oh, bummer.
Same Ben. Yep. So he's saying September, but we have a few projects that are kind of pending around that time. He said, I'm not going to leave you guys high and dry. He'll stick around and kind of finish that stuff up. Obviously, we're not going to abuse him, but
Can you get it in writing?
just trust him.
Okay.
Couple other things here, more technical, unfortunately, sorry. Our hospital runs on 4 hosts, 4 servers, 4 hosts, lots of servers running on that. That's called virtualization. One of those hosts has a critical memory error right now, so that is down. So that has reduced our capacity by about 25% to run the hospital. We have parts on order. I'm saying this to bring up the point of why it's so important that we have redundancy. In the event that we did not have pre-planned for something to fail, we would be in a really sticky spot right now. We'd be shutting down non-critical servers, would make things a lot more difficult. So I know I spend a lot of money sometimes, but sometimes that redundancy is really important because, it's going to take a few weeks to get those parts in. So it would obviously expedite if it was an emergency, but it's just important. But
On the internet, I know we went through for redundancy with that, net, what's the name of it?
GeoLink,
Geolinks,
Yep.
yeah.
And with Elon's program, I mean, that's instant and dependable.
I'll touch on this. Something I looked into. The reason we can't do it is we have a lot of services that need their own, what's called a public IP address to be accessible from the outside. With Starlink, you only get one. You can't have multiples. So it simply wouldn't work for us in its current state. I don't know what he's going to do in the future, but right now. However, we do have redundancy. We have both.
I know.
Yeah,
but
and
just-
it's been fantastic to have that level of redundancy. But
Good, thank you.
last month in my written report, I mentioned that we're working on a new forms repository. That's now live, so that gives all staff the ability to hop on, grab the most current form, because there was problems with like, hey, this form's like 7 years old and you're still using it. Hopefully we have like a one-stop shop now that people can just get on and grab the form.
Our capital projects form, is there a new one on there yet?
That's coming.
There's like 1,500 forms there. Oh, that's what you're talking about.
That's what
CER, yeah.
my form. I'm personally doing that.
Oh,
good.
I think he's intentionally dragging his feet because that's a deterrent to ordering capital.
Yeah, the amount of money being spent is just increased. There's been dozens of things. I'm like, it's not worth filling out the form. Dina continues to make good progress on getting all of our policies and procedures on a new system. I'm real happy with that. That's going to be a big help to us. There's lots of reasons why we need to do that. What's that?
I've been
Oh.
on, so.
Oh, Ben. So yeah, it'll give the ability to, most importantly, notifications to managers for when they need to complete their policies and procedures, make sure that that's kind of up to date annually, as well as once we're fully live with it, notify people when there's a policy change, because right now we don't have the best mechanism to do that. So this will require that. The final round for this fiscal year, the physician time study is going to kick off May 11th. So at midnight, May 11th, we'll do, I think it's a 2-week period to report for that physician time period. That'll hopefully help maximize our reimbursement. So I have that all set up. Process improvement meetings. I know we've talked about in here before. Every week we have a process improvement meeting with a group of us. So that continues to make lots of strides in helping all of our processes. A couple things that we've worked on is obviously policies and procedures, contract review. Mark's brought stuff in there to improve process for admission times to the floor. We've improved the convenience for patients to do payments in PT. They can now use credit cards before there's like some runaround going on. That wasn't a very good process. We're working on improved utilization for e-prescribing and then paper reduction alongside of a bunch of other little things. So just a few little points there.
And that's a neat forum for any manager who wants to improve a process. They can come and they can present it to the group and we can come and brainstorm.
Correct. Yeah, we've opened it up to all managers. Hey, if you have something that, isn't working right, let's all talk about this and see what we can do to make it better. And then lastly, we're working on a community survey to send out to the community to assess how we're doing. It's going to go out via email to about 1,600 people.
Can we talk about that? Sorry.
Oh, yes. Go ahead, Dina.
Yeah, we haven't finished our discussion on that. You weren't ready to do that, were you?
I'm not rolling it out right now, but it's something we're working on.
Okay, we need to talk. Thank you.
Maybe I'll pause what I'm saying. Okay, and that's the end of my report.
I have a couple comments, questions.
Please.
One on the process improvement. I think what you're doing sounds fantastic.
Mhm.
Like, sounds great. If you have the opportunity to include somebody who's doing that work, one of the frontline people in the discussion, sometimes you'll come up with even better stuff. So as managers have different perspectives than the
Correct.
people that are getting the work done.
Very true.
So I don't know how it works, but boy, if you ask the person who's doing the work, how could you do this more efficiently? It might blow you away in some instances. So it might be worth the effort.
Well, that was really some of the theory behind lean and all those
Yeah.
other things was you bring it down to the person who's doing the job and you figure out how you make this faster
Yeah.
or better or from a quality perspective or whatever. So, yeah.
So just, if you're stuck or just want that frontline person's perspective, it might be really valuable.
And Dina and I have been talking about, if we're going to put together a meeting to take a look at some of the quality care issues like with ER and so forth. And that team will involve staff
Good.
to do that as well as the doctor and everything else.
I think it's a critical step.
Yeah. Yeah.
And the community survey, I don't know what your time frame is on that, but it might be really good to get your marketing person that hasn't been hired yet involved in that before it goes out.
Agreed.
Okay.
When does when does your committee meet?
I don't know. I'm going to talk to Dina after this and there's stuff.
Are you talking about the quality improvement?
Oh, process
Process
improvement,
improvement.
weekly,
That makes
Tuesdays at 10
in this room.
in this room. But if you have something you want to talk about, shoot me shoot me an email first. Shoot. me.
It's on 10.
She's a good shot.
Thank you.
She
Sharon.
has a realtree archery sticker in her back window.
That's
And
not what
I-
you have to worry about.
It's not on the agenda, but Deb's report, do we want to go into that right now too?
Let's see.
I have Deb's foundation auxiliary.
Can we
report.
call her real quick?
Yeah,
It's
I like your
It's
idea.
afternoon in Cancun. See?
Yeah, she's living it up over there. So I'll read what she wrote here, for foundation. During the foundation meeting, Jeanette Rogers Erickson made a motion to discontinue the Jeanette Rogers Erickson Heart Walk. The board is currently exploring options to replace that event or maybe give the Heart Walk a makeover. How
That came from Jeanette.
Yes, that's what she made a motion. So the Houchin blood draw is scheduled for May 20th. We have put in a request to reserve Soap Park for River Rhythms. There is no guarantee at Riverside Park for electrical. That'll be completed by August, so we're reserving Circle Park. We also have a reservation with Joe Ronco for the tent that we're going to use for Crab Fest this year. Auxiliary report, our volunteer appreciation.
Let me just
luncheon.
interject a thought here. Carrie is one of the headliners at the River Rhythms.
Cool.
Thank you for saying that.
My drawing to you.
You're no longer invited to profit.
Carrie, can I back up or just say?
Yes.
The Erickson thing.
Uh-huh.
Can we find out why she doesn't want to support us anymore?
I want to call her myself. I want to talk about it.
Okay, I'd like to get involved with that.
For auxiliary, we had a volunteer appreciation luncheon. It was well attended. Volunteers had a great time. Right now, they're really working well as a team. We just recently went down to the thrift store and saw like all the work that they were doing down there. It looks fantastic. Their organization is like the way they're organizing the department and the facility down there is really good. So she encourages all of you guys to go take a look down there and see for yourself. The volunteers wanted to express their appreciation for administration for stopping by and seeing what they've done. Oh, I just said that. I wasn't reading ahead. For the month of May, the auxiliary made $12,507.05 after expenses.
May?
Yep.
April.
Yeah, April.
Says May.
All right.
We're still in May. It's May 9th.
We're gonna go April.
We're right gonna go.
Really good day. The first
Thank you for
couple
your
of days.
report.
I didn't know Cancun was that far ahead.
I'm telling you.
She set me up for failure there.
I went by there today, dropped off some donations.
Yeah.
And they have baskets sitting right there at the gate, so you don't have to walk in anymore. There's just two little bins on wheels that you can just drop your stuff off and go. It was very convenient. It was a nice improvement.
Yeah, we walked around behind the scenes and kind of saw how they are organizing things before. Frankly, it was just kind of chaotic, and right now they have it really well put together.
It's great.
And they'll give receipts for donations,
Yeah.
so that's always good. Okay, thanks, Karen.
Carrie,
Good
can I
job.
have one question? Did you finish your report?
Yes,
The thing in Vegas?
Yeah.
As a rule, the way it works,
I can't talk about it. It's
You're on-
staying there.
you're on company time. And all your winnings, you're supposed to bring in here.
I did. I brought every penny I earned back.
Me too. I didn't give Heidi the receipt for that expense.
Does that mean my losses are also covered?
No losses.
No losses.
All
All
We
right,
don't have no losers.
thank you. We're gonna move on to F, which is old business for the health clinic recruitment update. Greg Davis.
Hello, I'm
Hello.
not yelling, am I?
Not now.
I was yelling before. Okay. So as Tim said, we've had some significant progress in our physician recruitment. We, since our last board meeting, we've extended 2 offers to physicians. One of the offers we really thought was going to be successful, and he ended up turning that down. We had another candidate who was also a very strong candidate who had kind of dropped out of the race earlier, but decided to put his hat back in. So we've had negotiations with him. We extended an offer to him, and he's verbally accepted an offer today. So good news. And so very good news. And Tim and Cody Bogarelli met with this physician on Saturday. Was it Tim? Last Saturday? So Dr. Mongar's in support of it. We desperately need a family practitioner in the clinic. So we're looking forward to that. Tim and I have a little discussion to have about it this afternoon, but it looks very, very promising. So good news.
Thank you.
So this is an MD or a OD?
Yes.
So it's not
Family
midlife.
practice
It's
physician.
The doctor.
MD.
Great. That's good news, Greg.
Well, we needed that too, because we want to remove that issue with current health.
Yeah.
And some of the others for new patients.
Yeah.
So we, I always, we have a verbal acceptance of the offer. It's, I always look at white and, see the whites of their eyes. So we really, really need to, not drop everything. So we'll continue, continue our efforts to, maintain a good, platform where we can, recruit for all of our healthcare providers in the district. We've had several recruiting companies that have helped us with this search. One of them, we signed an agreement about 2.5 years ago. It was actually a 1-year agreement. Because they didn't place anyone, they kept extending it out, but they gave us notice a few months ago that they would end that support in May. We could extend the offer if we wanted to, but we didn't want to put additional funds in. So we're looking in the future for contingent placement firms if we need them. So hopefully we won't need them anytime soon, but things are going well. It looks very promising.
So what's the start date tentatively? Do you know yet?
This candidate is very enthusiastic about starting as soon as he can. So
Yeah,
Like a month, 2 weeks? What?
Tim, maybe you can answer that better.
he would like to be here as fast as he can get here.
Okay, great.
How quick your credential them to work?
That's the issue that Greg and I are going to talk about after the meeting. So that's his only concern right now, is how quick to get the credentialing done. So we're going to talk about that.
Great.
Thank
So
you. That's good.
I'm,
Good news.
if you're okay, I as long as this position is placed, are you okay if this comes off the board agenda for next meeting? Not that I have a problem coming and talking to y'all, but hopefully this will be good.
I think you've solved the problem.
All right.
Are you
Well, if it's on
sure?
if it's on the agenda next month, then you'll know that we have problems.
when we see the whites in the
Once it falls apart.
We want to see the whites of your eyes.
Basically means we've been looking for 2.5 years and all we had to do is get me to move out of the state and we hire someone. So,
Amazing.
Well, if it doesn't work out, you can move back. Just
I'm
kidding.
sorry, it's internet's bad. I
Yeah.
lost.
I'm sure it is. Thanks, Greg.
Oh, Elon.
Good work.
Thanks, Greg.
Hey, new business. We have the building and planning meeting in it. Jean,
Okay. There was an article in the paper and there was a lot of talk about that grant. The grant, we need to clarify, was supposed to have been funded by September of last year.
Which grant?
It's a FEMA.
the FEMA.
Okay.
And so we need to clarify that whenever we're talking about, maybe we're gonna get the money. That normally those funds are gone for last year unless we resubmit. Are we working with this girl on a resubmission?
No. That's the grant. What they told us, because Bob asked the Cal OES, California office that handles all this stuff. They're the ones that take our data, they process, they forward it to FEMA for us. She told Bob that they're still paying out on projects from 2021. Ours is in the 2022 pool. So she says, I can't tell you right now when they're going to start getting to that. The fact is they have been sending us, we've had 3 rounds of interrogatories on the application we submitted and so forth. So far, those have all been cleared. And so she still believes that we are in excellent position to get that. It's just FEMA works at FEMA's pace and there's nothing we can do about that.
So there are other people that's not funded yet. It's
Oh, yeah.
works.
Most of them have not been funded.
21.
Yes, that's right.
Okay, well, Bob didn't explain that. Okay, let's,
The state still believes we're in an excellent position to get the money. So it's just like I said, you gotta jump through the roots, yeah. We don't know how many more questionnaires they're gonna send us or things like that, but the nature, like I said, on this last one, when we talked about it in building and planning, you know, they were asking us about differences in monies from one page to another that were, you know, $30 or $15 or something like that. So it's pretty
I
small.
thought they
nature.
got funds they had.
Those funds are
Money.
all still there. Yes.
Okay.
All still there.
So,
But that is a fair point. Usually sometimes those funds, if you don't use them.
Well, that's true if you've been awarded the money and you haven't spent it, yes. But they're still waiting to award the money.
Oh, okay.
So they haven't awarded anything yet.
I think that much better.
Kidding. Kicking.
is it helping you headache any?
Go ahead.
Oh, perfect. So, back to the consent, agenda. Do we want to go back and approve and accept the minutes pending for that building and planning?
That would be the new.
Well,
one, so.
yeah, I would make the motion, we can accept it with that on there also.
Okay.
Thank you. All in favor?
Aye.
Good job. Thank you, you guys. Director's comments. Fred.
Believe it or not, I have them. What's wrong?
Perfect.
Glad to be here.
Don, do you have any comments?
Just a couple of brief ones, and Carrie did Debbie's report because she's not here.
Right.
Well, I just want to, make this known for the board meeting minutes that I was also in Cancun with her last week, and I did call into the Med Quality Committee.
Good job.
So,
Can't be done.
I didn't realize you were with her.
from the pool side.
I didn't know you were down there, but.
He has a margarita in front of him.
Well, I was on the phone, so nobody saw me. And my phone unfortunately did cut out about halfway through the meeting, shortly there before. So I apologize for that glitch, but anyway, I was doing my fiduciary responsibility, even though I was on vacation.
Thank you. Good job.
Much appreciated.
Second thing, I meant to mention this at last month's meeting. I was not aware that Barbara Cassis had passed away several months ago.
Wow.
And so she had served on this board for a lot of years. It's just kind of sad that we've had three past former board members of this district pass away in less than a year. Charlie Bush, Bob Jameson, and Al. So I just wanted to recognize her.
Everybody's looking at me now.
They wasn't at me when I was in the ER last month. So. But no, I just wanted to, mention her that she, her years of service.
Yeah, thanks for bringing that forward. I hadn't heard that she had passed.
I didn't know either.
Anyway, that's all.
Thank you, Tom. Jean?
It looks like things are getting a little smoother. We're not pressured to do too much all at once anymore. Maybe we can move forward in a smooth, very constructive, productive. So I'm starting to feel better about our direction. Thank you.
You're welcome. Thank you.
I agree. It still feels like things are coming together. We're in the final run-in for this FEMA grant. We've got the HCI approval. Funding's okay. We're holding on. We're paying our bills and have black days instead of red days.
Right.
Things are going good. I'm happy with the direction we're going to.
Thank you. Just a couple of things. First of all, John, thanks for bringing that information about Barbara, because like I said, I had no idea. I want to thank Amy for, continuing to work on what she needs to do and bring it up where, she's comfortable and stuff. So I know that's, it's not anything I would want to do for sure, but also just that, how the board is working with each other. I think it's been really nice that, I don't know, we're not boxing or, arm wrestling or anything like that. So I appreciate that, you guys.
Yeah.
And I would like an invite to the next Las Vegas trip. Put that out there. But, and thanks to Greg definitely for working and getting us a new doctor for the clinic. That's awesome. So that's all I have.
It's hard to arm wrestle you when you have a cast on too.
I know. Well, the
No.
only way you can take me.
Very-
Okay, so we are going to go into closed session. So we will pause.
So can we?
Yep. I'm gonna leave. I'm just gonna make sure Heidi's got this. Sorry.
Yeah, I don't think I need to stick around, do I?
We're gonna come back into open session or the board committee meeting. Sorry, I can't even talk. And have the closed session report from Scott.
The board received a medical quality report. The council gave an update on the Benson and Volkova lawsuits. No action was taken and no other items were discussed.
Thank you. And we're gonna go into ethics training
Yeah.
this hour.
Now, is that public? Is it public?
Yep.
Watch you?
Yeah.
Cool.
Yep, it is. So who is up for election this year? All right, so are you out there raising campaign contributions,
Oh,
knocking on doors, walking the streets, fundraisers?
No.
Yeah, okay. I've never seen a campaign contributions ethics issue. But you just need to be aware that there are, excuse me, certain laws and regulations. However, for Ross, bye. Okay. For local agencies, most of those do not apply. Mostly statewide office, the campaign contribution laws apply. So I think though, if you raise more than $1,000, you have to fill out the campaign committee form and file that with the county. Is that right?
I think it is $1,000. I remember signing that. Yeah.
So
I
if
think
you're out there
it-
doing that. So I think last time I talked about the shortest topic discussion, bribery. Don't offer a bribe, don't accept a bribe. It's a crime and you'll go to jail. You'll be barred from holding office in California forever. And that might be a bonus to you. It might be like, all right, what's the problem with that? Yeah. But generally, once you engage in bribery, there are some other crimes related to public office, but we'll get to those in a minute. Maybe I'll restructure that. So I'll put all the crimes in one section because you can usually go through those pretty quickly. So let's talk about leaving office. When your term is up, couple things. One is you file a leaving office form 700 within 30 days that covers the period from the prior form 700 until you left office. So I have two directors at an agency who both moved out of state. May 1st was their last day in office, so they had to file a leaving office for January through April. So you just have to be aware that when you leave office, you have to do that. When you assume office, you have to do that as well. And then when you're in office, it's just annual.
So then it's a legally registered when you were in.
Yes. And what your economic interests were while you were in office. That's really what they want to know. In case someone wants to go back and say, oh, well, they voted on this decision. Why did they do that? How did it impact them? So there's also a relatively new law, I'd say within the last 10 years for public officials, local, not state, not federal, but local. When you leave office, you're prohibited from lobbying the district on behalf of a third party for which you receive compensation for 1 year. So for 1 year, someone can't hire John and say, John, you go in and convince the board to approve this contract for this service. So that's relatively new. I've actually seen that as an issue. And so I had to talk with the former director and say, all right, well, you need to be aware of this and you have to be careful. And like, well, I'm not getting compensated for it. Like, okay. Yeah. Okay. Not officially, at least.
Seems a reasonable thing to be. Although it's a new law.
Yeah.
Seems like it's reasonable.
Well, it's been in place for a long time at the federal level and at the state level. So they just extended it down to the local level. And if you're in someplace like an urban center, LA, San Bernardino, San Francisco, Bay Area, right, it could be an issue for sure. Smaller rural areas, it doesn't tend to be as much of an issue, but it can be. Especially if a former director has a consulting business. So, however, you can lobby on behalf of your own business. So if you have a business and you want to contract with the district and you're no longer on the board, you can go to the board directly because it's your interest. It's not a third party's interest. Or if you're representing another government agency, because government agencies are never corrupt and never do anything wrong. So they're exempt from this prohibition.
How would you, like if you wanted to do something on your own? If you talk to all 5 board members separately, is that any kind of violation there? So you could do that, okay.
Yeah, let's say you're off the board and
So
You
it
think
doesn't whip back to them about talking a chain from the other side.
well, that's a Brown Act issue, right? That's a little bit, are you talking about circle meetings?
Right, well, the one meeting all 5 of them.
So that's fine, right? You can be lobbied by your constituents. If 3 of those directors got together outside of a board meeting
Yeah.
and said, hey, Scott lobbied us on this, what do you think? How would you vote? That would be a Brown Act violation. So the example I was going to give, you leave the board, you think the district's insurance policies are not proper, so you want to get into business, you're perfectly fine going and talking to all 5 directors saying, this is what I can do for you. If 3 of those directors then start talking, that's a problem for them, but it's not a problem for you. So that's the leaving office, the bribery leaving office. So the perquisites of office, because you guys get so rich doing this.
Right.
Right, and I know that this is how you're gonna retire, take that Cancun vacation, travel Europe, and you're off the board. Anyway, yeah. So there are some rules regarding this, and that's because you have a fiduciary duty to the district. So you should not be using your position to get rich yourself. So you have a limit on gifts. A gift is anything of value that you receive from someone else. I think it was $590 was the limit for 2024. That's what I said last time. Wrote it down. It's $590, and so $590 would be the maximum you can receive from one source in a 12-month period. And so that's a rolling period. It's not a calendar year. All right, so that could be money, it could be tickets, it could be travel, it could be all sorts of things, anything of value, $590 or more. It's $50 or more, you have to report it on your Form 700. Okay, so you have your reporting requirements and then you have your cap. Anything under 50, you don't have to report. But, you know, if you get 10 gifts, I guess it'd be 12 gifts, right? Then, and it's under the 50, then you're reaching the cap. My math is off, but you know what I mean. $49.99. however many times. You don't have to report it. You can't exceed 590. If it had been 490 this year, it would have been much easier doing the math on it. I just want to say, don't hold it against me. Do you have to disclose it on your Form 700? What are the exceptions? Well, it used to be that this law pretty much applied to anything. And then I think a lot of people complained about it because they're like, well, what about a wedding? Or what about a holiday or an anniversary? So the FPPC started creating these exceptions, and it's actually a number of pages in the regulations for the exceptions. Gifts from immediate family, parents, siblings, children, grandchildren, grandparents, aunts, uncles, and cousins are exempt from the gift limit unless they're giving you the gift because of your role as a public official. All right? So they're trying to curry favor with you for the work you do related to the district, then that's an issue. But if it's just, hey, Merry Christmas, here's a new car, you're okay.
Perfect. I need to meet that person.
The other general one that I encounter the most is you have a lifelong friend and you exchange gifts with this person. It may have been a high school or a college friend or something like that. And you're in the habit of exchanging gifts for birthdays or holidays or whatever. And the limit's, higher now at $590. But let's say you're extravagant with one another. Don't tell your spouse first, but second, those are exceptions to the gift limit as well. Unless, of course, it relates to your role as a public official and they're trying to get business from the district. Okay, so if you are getting an expensive gift from someone, something of value, and it's not a part of a business transaction, but it's personal, and you're just getting it, and it's going to be in that range, feel free to contact me. And we'll talk through whether or not there are any legal issues with that. Honestly, I haven't really had issues with gifts before. I did have one CEO who exchanged gifts with a friend that had gone on for a long time, and they would get up, they'd kind of push, and so we'd talk about it, and I'd be like, no, that's okay, right? This person isn't asking you for anything in your role as CEO. It's a different state, so like that, right? So, but let me know, and we'll talk through it. Loans have to be disclosed on the Form 700, and loans have to be in writing. I think it's $500 or more, they have to be in writing. If it's like your mortgage, you don't have to disclose that. But if it's a personal loan, or you need $1,000, right? And a friend gives you $1,000, you have to put that in writing, and then you have to disclose that. So just beware. Never really seen any issues with the loans, because for most people, it's a mortgage, it's a car loan, it's a credit card. So it would be exempt from disclosure. But if you're doing loans with friends or acquaintances or hard money lenders, first, don't take a loan from a hard money lender. But second,
When you disclose it, if it's in the middle of the year or the middle of the month, or when it goes into 700 form. So it doesn't count until you fill another one out or you leave. When do you disclose it?
so your Form 700 is for any transaction that is one of the disclosable interests in that year. So for 2023, if you got a hard money loan in June and you paid it off in October, but you still have to disclose that because it was a loan you
It
received.
just goes in January?
Yeah, for when you, so you, for 2023, you file your Form 700 by April 1, 2024, and that's the form it goes on.
Okay, so you could go for a year before you ever report it.
Yes.
1 year.
Yeah, it has to be on the form for the year in which you received it. So I had a client who did hard money loans and ended up losing his property. Yeah, so avoid that if at all possible. They're pretty ruthless.
Well, it's hard to get money in this valley, so.
Hey, am I looking at the hard money lender right here?
It's possible.
All right. Honoraria. Honoraria is something that you receive for giving a speech, making an appearance, doing a promo for someone or something. Right, so you are not permitted to receive honoraria if you're appearing as a public official. Now, the board can vote and choose to pay you your per diem for going out because if you're representing the district. But let's say there's a conference up here and they have a bunch of local public officials. And they're like, come out, you're going to get free lodging, free meals, and we'll give you $500 for the day. Well, you can't do that. Prohibited from doing that. The exception is if it is part of a bona fide business. So you two are insurance agencies. If you go to a conference and you're asked to speak, and that work has nothing to do with the district and is related solely to your work in the insurance industry, then you can receive honoraria for that. So in the example that PPC gives is if you're an educator and you go and you speak at an educational conference, right? You can get travel to the night before your speech, the night of your speech, travel home. If it's, say, 5 days, you can't really be compensated for all 5 days. You can be compensated for the days surrounding the event that you participate in. Right? So if any of you are ever asked to go speak somewhere, because the ticket rule, the lodging, the travel, the food, that's all highly regulated as well. FPPC has, several pages on that. So if you get invited to do that, let me know, and we'll just work through what you can and cannot do. All right. I had a director who had done something for which he was very famous and was known around the world, and he was asked to go speak at different events around the world, and he'd be flown all over the place to go speak. And he was on a board, and it came to my attention that this was happening. He didn't tell me, but it came to my attention that this was happening. So I'm like, so tell me about this. And so he's telling me, and it's clearly not exactly related to his roles as a public official. But he made a lot of money off of that. And the people he talked to could have an interest in the agency where he was the director. So it was kind of the same field. And so he didn't want to, every time this happened, he did not want to talk to me about it. Right? He's like, Scott, I don't have the time or the energy. I'm not going to tell you. I said, okay, well, the general rule is if it's part of a bona fide business, then you can do it. And his response was, yes, my business is public speaking. I'm like, okay, all right, we'll see how that plays out. So anyway, be aware of that. So a big one, the next topic is kind of a big one, and that's use of public funds. So we really have to be, there are two things that we want to be aware of. One is misuse of public funds. The other is gift of public funds. So gift of public funds is where you use district money or resources for a non-district entity. All right, and making a donation or something like that, supporting, promoting. You have to be very careful because the rule is the money that the district receives, the funds and resources it receives belong to the district. And it's not to be used for third-party purposes. Now, this is a pretty tight rule. You can't even use it with other government agencies. So the Golden Gate Bridge is owned and operated by the Golden Gate Authority. The Golden Gate Authority makes its money from the tolls it charges for people crossing the bridge. It turns out they make a lot of money. They make more money than they need to maintain the bridge. And so about 20, 25 years ago, maybe more, it was probably actually in the 80s, 40 years ago. Wow, time flies. It's a long time ago. They had more money than they knew what to do with. And the people who paid the tolls were starting to get a little uptight about the fact that they're still paying these tolls, and the authority just kept accumulating the money. So the authority, reasonably in my mind, thinks, well, we'll give City and County of San Francisco some money to do repairs to the 101 approaching the bridge on this side. And we'll give some money to Marin County to do repairs to the 101 on this side of the bridge, ostensibly related to the bridge, right? And it's reasonable. It's going to repair the freeway. And they got sued. And the court said, yeah, that is a gift of public funds. You cannot do that. The money you make can only be used for the bridge. And if you're making bank, then you need to lower tolls or find some other way to deal with that. So you're very restricted in what you can use your money for. So this relates to employee bonuses.
What was the penalty? Was that a true case that you're talking about?
Yeah, it
What was the penalty? Who was penalized?
So what would happen in a gift of public funds is that the two counties would be required to return the funds to the authority. And then the public officials who authorized it could arguably be sued for misuse of public funds. They worked out a deal, and I don't know what the deal was because it was after the appellate court said you can't do this. So I think rather than appealing to the Supreme Court, they went back and settled and said, all right, we'll never do it again.
Cool.
But let's talk about your employees. So the law with employees is when they accept employment with the district, they accept it upon the terms and conditions at which it is offered. So public employment is not a matter of contract. Tim is the only person you should have an employment contract with by statute. It's the only one in the healthcare district law that you're authorized to make a contract with. I'm not talking about independent contractors, I'm just talking about employees. So every other employee holds their employment by statute. So what is the statute that applies to them? Well, it's the healthcare district law. It's certain provisions of the labor code. It's certain provisions of the government code. And then it's the district's policies and procedures. So when we look to see what the terms of employment is for a particular employee, those are the sources we look at. Government code relates to it has statutes that allow you to offer benefits. It says what those benefits can be, how you can offer them, right? And then you go out and you buy your benefit plan and you implement it pursuant to a policy. So you cannot change that term of employment during the year. And you can offer bonuses, but you can't do it retroactively. So in other words, if you want to offer a bonus, you do it at the start of an employee's annual or their anniversary date. Right? If you're hired on January 1, the January 1 is when you would look at it. To do a bonus, it has to kind of be objectively verifiable. Right? So there's retention bonuses. Like if you work for us for a year, we'll pay you a $10,000 bonus. If you work for us for 3 years, we'll pay you a $30,000 bonus. Right? So you can objectively verify those. Yep, that person worked for us for 3 years. Here's your bonus. So you have retention or statement bonuses. Then you have performance bonuses. Well, you have to quantify the basis for the performance bonus. It can't be, yeah, we think you've done a good job, so we're going to give you a bonus. Right? In the private sector, you can do that however much you want. Right? You have someone who put in outstanding effort during that year. Right? It's the, what is it, the 80-20 rule or whatever. It's the 20% who are doing the 80% of the work. And so like you want to reward those people. With public agencies, you can't really do that because you have to be able to justify why the bonus was given. And you have to do that. Those measures have to be set at the beginning of the bonus period. So sometimes they give you a hard time about bonuses. Like, yeah, Gene, we can't do that. Right. And I know that the employees work hard and there may be times where they deserve that extra recognition or whatever, but we can't always do it because we're looking at it retroactively. And so it would be a misuse of public funds to say, we're going to bonus one employee, we're going to bonus all employees when you just decide to do it in its past performance. So some agencies have bonus programs that are on a fiscal year. They measure performance and they say, oh, all right, we have performed. And so because of your performance, this is what you get. Oftentimes it's tied in with the annual evaluation and maybe it goes along with a COLA or merit increase with their pay. So the earned, the retained employee credit, earned credit, whatever that was. So with California, part of that was designated to go to the employees. All right, well, great. The law says this money goes to the employees. Guess what? That money goes to the employees. But the Fed is a little more ambiguous. And so because of that, we came up with the program for analyzing who would be eligible and how much they would be eligible for. But the thing you guys have to understand is the law is not really flexible on this. This is a misuse of public funds issue. And so we just need to be aware of that. And it's also the agency, one, under the transparency laws, the public knows how their money is being spent. It's not someone saying, a supervisor saying, I really like John's performance, let's give him a $5,000 bonus. All right, well, why did John get a $5,000 bonus? What did he do? How did he earn it? And wait a minute, how come we didn't know that this was a part of a budget? It was
harder than him.
Yeah, well,
Yeah, but he's
he only got 2,000, right? See, that's the thing. He got 5 and you got 2, and how is that fair, right? And what does the public think of that? So anyway, so we have to be careful with that. Public funds have to be used for a proper purpose. and they have to be properly authorized. So we, like a lot of contracts and stuff, we bring to the board. You are charged with all oversight of the district. However, you have authority to delegate some of your authority to the other officers of the district. And you've chosen to delegate some of that authority to Tim. Well, that makes good practical sense, right? We can't bring, if we had to bring everything to you guys, you'd be meeting every week. We would be calling special meetings all the time. From an operational perspective, that doesn't really make sense. So you can delegate authority. Right now, Tim's the only other person who can approve or sign contracts as long as they're within his authority. Otherwise, we have to come to you because you are the only other authority who is authorized to spend the money in that way. So, and you haven't authorized Tim to delegate his authority to anyone else. Right, so Tim can't say to Mark or to whoever, you have authority to, like, let's say Tim's authority is at 25,000. He can't go to Mark and say, well, I'm delegating authority to you for 10,000 unless you've told him he can do that. So, you know, we have our contracts policy and some of that authority. That's where the delegation occurs. But it has to be used for a proper purpose, which means a public purpose, and it has to be properly authorized. If those two factors are not met, then it's a misuse of public funds. So what about if you're having Riverwalk and you want to pass out water bottles, or you want to have a station there to help the people who are walking or jogging or whatever, or you want to buy an ad, become a sponsor. Can you do that under the misuse of public funds law? Well, you can if you are promoting the public interest of the district. So with like water districts, often what they'll do is they'll go to these festivals or conferences or day in the park, and they'll have the water bottles, and they'll put the water district's name on the water bottle, and they might put like conserve water, right? And then they can go and they can pass those out for free or do whatever. They can donate it to whoever is hosting or running the event because they are serving the public purpose of promoting the district. So like if you're like, be heart healthy, drink water, right? You can do that. Or KVHD, our ER is open 24 hours. Right? So you're promoting the district, and that would be a proper public purpose. So that's how we do some of those things that otherwise seemingly you can't do under the general rule of no one else gets your money. All right. So like when those things come up, we talk about them. Tim or Heidi or Deb or Mark or someone will say, hey, Scott, we want to do this. Can we do it? And generally it's like, all right, yeah, you're serving a proper public purpose of promoting healthcare within the district. So that's okay. If there was something going on in Bakersfield and you wanted to ship water bottles down there or great coffee mugs that say KVHD and give them out for free, I'd probably say no, because that's outside the district and is really promoting what you're doing up here. If you go over here for the fishing derby and do it there, well then sure, some of those people will likely end up in your ER for one reason or another.
A few of our derby guys end up in the ER with hooks through their finger.
Hooks, yep. So
entertaining, actually.
So it's not that you can't do these things. It's just you have to make sure that it's a proper public purpose that relates to the district. And you get, as the board with fiduciary duties, that's what you're charged with. The employees have a duty of loyalty. The employees do not have a fiduciary duty. So their duty is not as great as yours. So anyway, gift of public funds, misuse of public funds. Some act as if they have a fiduciary duty. So, mass mailings, this has become less and less of an issue. But it used to be back in the day, Agencies would, again, going to waters or schools or something like that, they send out their bill and there's a flyer in there, right? Or they might send out a newsletter. Well, you can't spend public money on a flyer that is promoting a particular official. So we had a water district years ago, and they wanted to, and they did a newsletter. And in that newsletter, they wanted to do a highlight of an employee or director in each newsletter. We said, well, if you want to do the employees, that's okay, but you can't do the directors, because that would be like campaign expenditure for the particular director. So how it works out in mass mailings is you really shouldn't have like a message from the president. Sorry, Catherine, nothing against you personally. But you can have a message from the board if it has all your names on it. So there's a question at one point in time, well, could you say the positions they held, president, vice president, secretary, treasurer? And if you were really conservative public agency attorney, you said no, because then you're saying, oh, I'll see Catherine's our president, so vote for Catherine. And if you were, I thought, more a commonsensical attorney, you'd be like, well, it rotates every year, right? So if you just rotate it, what happens is most of the time they just put the names of the directors. But I don't know, do you guys ever do mass mailings?
What about TikTok?
So,
And we did mass mailings.
Same mass mailing, same
Yeah.
TikTok would be the same.
yeah, so for the district cannot promote individual directors. Anyone else, Tim on down, you can do it. Employee of the month. Yeah, this employee is receiving recognition for outstanding work.
So it'd be the same as mass mailing.
Yeah, so you can do that, but the district, because you're elected, the district cannot be seen as endorsing one of you.
So if they endorse someone that they like Heidi or Beauty Queen, but didn't say this is Kern Valley Healthcare, they just endorsed her through their AI system.
No, so let's say the healthcare district has a TikTok account.
Mhm.
And let's say Heidi is entered into a beauty pageant. The district could say, vote for Heidi Sage for beauty pageant, right? If Carrie got employee of the month, because he worked for, you could say, we're recognizing Carrie for his outstanding efforts to keep us up and running despite all these problems. Totally fine.
Okay, what if
But
they did
Gene-
me?
If Gene said
Said
that,
I'm in favor of everything, so we're gonna reward him by putting his picture in there.
so if Gene's in the beauty pageant, they can't say vote for Gene because he's a district director. Because then they're
I'm not going to the beauty pass, but I have to admit, I do want to be able to publicly post him wearing the swimsuit.
Yeah. So what the district has to be aware of is the impression that it's endorsing elected officials. Same goes with ballot measures, right? You can't endorse a ballot measure. You can put information, factual information out regarding the ballot measure, but you have to set up a separate campaign committee to go out and do the endorsements and the flyers and all of that. Public employees, while they're on the clock, cannot be involved in campaigning activities. And they can't use district resources, copiers, paper, pens, any of that. When they're off duty, they can do whatever they want. They have a First Amendment right to say or do whatever they want. And by the way, all of you, by being elected, to not give up your First Amendment rights. So you can do that too. When you're acting in your official capacity, be a little bit more careful But that's mostly related to, are you speaking on behalf of the district or yourself? Right, because you act as a board. You can only act or speak on behalf of the district if the board authorizes you to do that.
Okay, question, if the foundation is not directly related, they're indirectly and they're tied in different ways. If they wanted to shuffle it over to where they did the same thing, would they be kind of the same?
You know, they can do, they're a separate nonprofit corporation.
The foundation?
Yeah.
Okay.
And so they can
Well,
do their own
the
thing.
fact that we pay for most of their activities, does that tie us down to us in any more or any way?
So it could. And the other implication of that is they could be subject to the Brown Act. So private entities that are funded by public entities may become subject to the laws that the public
It's like the
entity.
river residents that couldn't exist without us. So the money they're getting, we're like part of them. Do you follow me?
So it depends on how it's being structured. I don't know exactly how it's being structured.
Which part of River Rhythms? The foundation is sponsoring it.
The insurance. It's hospital insurance.
It is the hospital's insurance.
So does that cost the district anything, or do you just add them as additional insureds?
I think we're just adding them as additional insured. I do not believe it raises our premiums.
Still a consideration.
Mhm.
And could have a loss that would, I mean, their
So-
insurance is high because of that.
Their insurance or your insurance? So Beta knows.
Yes,
You add them on.
I believe so. Deb Hess is the one that would be doing that. But anytime we have a big event, we usually request another certificate for that particular event.
Yep. And then what is the consideration the district receives? Are you promoted? Are
Yes.
you advertised at the event?
The money that they raise, we get it back.
I would say that's. That probably doesn't implicate the Brown Act. The Brown Act is more an issue if, like, this board is appointing the members of the board of the foundation. Or if you were the members of the board of the foundation, then essentially you're acting in your public capacity and you'd be subject to the Brown Act.
For the Knights, part of both at one point.
Yeah, and you can be part of both, but the question is this board appointing or designating? Right? You can be part of other community boards or groups in your personal capacity, but if this board has control over that, then it becomes more of an issue.
Okay.
Okay. Transportation. There are all sorts of rules related to transportation, tickets, lodging, meals that you can receive as a public official. Doing it other than going to, say, ACHD or CSDA or one of those conferences the district pays for. Do you ever do any travel? Do you ever get tickets to Laker games? Anything like that?
I'm not going to LA for anything, period.
It's torture, right?
Yeah, no.
So, so you just have to be careful. So if anyone ever offers you to pay for your travel to go somewhere in your official capacity, let me know and we'll work out what that is. There's a rule that you cannot receive free travel from a transportation company. It's because in the 1800s, the railroads were gobbling up land in California, getting all sorts of franchises and rights to lay their track. They started to accomplish that by giving free travel to members of the Assembly and the Senate in Sacramento. And so a constitutional amendment was passed that said you can't get free travel from a transportation company to stop that practice. So what does that mean? So in the 70s, there was a member of the assembly who got married. He and his wife were going to Hawaii on their honeymoon, and they flew PSA, which was still then in existence. PSA had this policy that if you were newlyweds going on your honeymoon and there were seats available in first class, they would bump you up. No one does that anymore. That was great back in the day. So they got bumped up, flew first class PSA to Hawaii, back. Happy, lovey-dovey couple. They got sued. He got sued for violating the prohibition on free travel, because PSA was a transportation company. And the Supreme Court had some common sense and said, look, PSA offers this to everyone. There's no evidence he was given this benefit because he was a member of the assembly or in any way influenced him in his official duties. You're cool. How that is rolled over into today is like mileage plans, right? There's no prohibition on getting a companion ticket or a free ticket or a reduced fare ticket if you're part of the mileage plan, so long as it's generally available to the public. So,
But what about, this is local.
Yeah.
Our transportation, we're given free rides from Bakersfield to here, there and back for about the past 6 months. And the goal, supposedly goal, is to get some of the illegals come up here and sort of find a way to, they mingle in.
so they aren't public officials, and this prohibition applies to public officials. So if you're getting free transportation to Bakersfield to go to a medical appointment, and it's not something that is offered to the public generally, but it's something the district does just for you, well, the district isn't a transportation company. Let's say it's, what is the Kern County bus?
Regional
called?
transit.
Regional transit. Say they're like, we want a new route that stops at the hospital here because we think there's a lot of business. How do we get in our foot in the door? Let's give Gene free rides down to Bakersfield to medical appointments, but they don't offer that to anyone else. That's a problem.
But their motive of giving the free rides is to get not specifically homeless, but they're wanting us to have more share of homeless. So,
So that's more a political issue than a free transportation issue,
okay.
right? So that would, I mean, honestly, you guys, if it's your transportation, then that is within your bailiwick. I mean, that's something you would address. As public officials, it's
We're
something
not
you would address,
organized enough here to address anything like that.
right? And you may like it or you may not. Maybe you have a huge labor shortage up here. Maybe people up here to work would be great. Or maybe you don't have the resources to care for them. Now you're gonna have people just wherever, and it's going to be a social problem. So you don't want to do it. Right? So those are the things that you guys weigh and you work through if they're using your transportation in deciding whether. So transparency laws, we have the Brown Act, the Public Records Act, and the Form 700 economic disclosure laws. Form 700s are filed annually while you're in office, 30 days of assuming office, and within 30 days leaving office, you're required to disclose your economic interests. And the point is so that members of the public can look at what your public interests are and compare them to the decisions that you make to see if you're making decisions that are in the best interest of the district and the public or in your own interest. Has any member of the public asked for a Form 700? So does the law accomplish its purpose? I don't know. I've never seen something come of Form 700. So, but you do have to disclose those interests, and sometimes it can be onerous. I had a director who was a day trader, and a lot of the stocks that he was buying were for companies, Coca-Cola, IBM, Microsoft, whatever, who might do business here. And he exceeded the threshold, $2,000, I think, for those investments. Well, you have to write all those down on your Form 700. You have to disclose them. So I was helping him with his Form 700 because he had some questions about that. And so I called the FPPC. And I'm like, this is crazy. He's a day trader. Many of his trades exceed this minimum threshold. In these companies, they're ubiquitous. They're everywhere, and literally everywhere, but it has no effect whatsoever on the district. And they're like, yeah, it's a problem. I said, but it's what the law is. So I don't know, I hope none of you are day traders. But if you are,
We all do a vote. Don't lose money at it,
yeah.
so it don't count.
It doesn't matter if you make money or lose money. It's if it's $2,000 or more that you're playing with. So just be aware of that. And then if you have your primary residence, of course you don't disclose, but let's say you have rentals or investment properties, we'd have to disclose those. And the reason why is maybe the district wants to house a doctor or a traveling nurse, right? If it turns out that that's what's happening, public has the right to know. So that's why we do the disclosures. If you own a business and the district is purchasing supplies from you, then that's an issue. When I was representing California City, there's a council member who owned the local hardware store. And the city daily went down and would buy supplies in the hardware store. So a council member who did not like this other council member said, Scott, is that legal? So I looked into it. I'm like, no, this is not legal. This is not legal at all. Because every day you were going down and spending $100 here, $100 there. And the council member who owned the store, his argument was, we're the only hardware store in town. So they're going to have to go to Lancaster, Palmdale, or Tehachapi, or some other place if they want to get the supplies. And that's going to cost more, and it doesn't make any sense. This was before Amazon was really big, and you just ordered online, and that was that. I said, I hear what you're saying, but that's not an exception in the law. And he said, well, I don't care, and I'm going to disregard your advice. And if the city wants to keep buying from me, the city can keep buying from me. And so the city did for a while, and then he thought he would be coy, and he transferred title for the business to his son. It was in his son's name, but it was still his primary source of income. So anyway, in small communities, those are issues though. Right. And so, but the Form 700 is supposed to suss that out. People figure out, oh, you own that business and the hospital district spends, $50,000 a year there buying stuff. We think that's a problem. So that's what the Form 700 is supposed to do. Brown Act, transparency law, the public has the right to attend meetings, to comment at meetings, to record or broadcast meetings. And so I did have an irrigation district in Lancaster. This was back in the early 2000s before Zoom and Teams was everywhere. He would come up, this local resident who was the troublemaker, he'd set up his camera in the back of the meeting room and he'd record the whole thing and then he'd go and post it online and offer his commentary, which the board did not like. They're like, Scott, can we stop him? I'm like, not unless he's disrupting your meetings. Well, he's recording us and we know he's going to take it and he's going to post it. And that we find that to be very disruptive. Like, yeah, no, that's not disruptive. You're still holding you're uncomfortable, but that's not disruptive. And so, but now you just broadcast them, right? Or they're on Facebook the next day or whatever. So the public has broad rights. Oh my goodness. I was the youthful looking attorney for the district for posts. Like is that a compliment or is she insulting me? I'm not really sure how to take that. Yeah, Laura,
She liked you.
did she? Okay. We clashed a few times, but anyway, like Laura, she would come in and she would accuse everyone of being a fraud and lying and cheating and stealing.
There were a few
Well,
times that she did disrupt, like, I know there was one meeting when Brad said, your 3 minutes are up, go sit down, and she would not sit down. So he could have kicked her out of the meeting, I guess, at that point.
and then do you know what she did the next meeting? She wrote like a 10-minute screed and she read 3 minutes. One of her friends read 3 minutes. I mean, she got it in, but she was creative. She was something else. So, but that's part of the deal. And unfortunately with hospitals, you get the people who might have a mental illness or something and they go off meds. And I mean, at Tehachapi, we had a patient at our clinic threatened to come in and rape and kill every nurse. And so we went and we got a restraining order. And he was young. He was like 20 and his parents were mortified and profusely apologized. Like he was off his meds. We're like, yeah, we get it, but guess what?
Yeah.
He can't come back. So, healthcare, you especially see that.
But it was the parents' fault because they had them.
Well, I mean, he was an adult, but they felt terrible about what had happened. And those nurses were like, I'm not going into work until we have security. And we're like, yeah, we get it. We get it. So the one that I really hardly ever see public participation is before we go into closed session, the public has the right to comment on any item on closed session. And I don't know that I've ever seen a member of the public do that. So,
Well, I hope you didn't jinx it just right now.
yeah, there are some new rules, 2024, about teleconferencing, how many times you can do it, and the availability of documents that are distributed in a board meeting. But Heidi and I have talked about that. So I think we're on the same page. Public records. So last year, they messed with all us lawyers. For decades, public records, section 6250 of the government code, right? And we know 6250 through, like after they got in all the healthcare exceptions, like 6265, right? The sections, they completely placed it in a new part of the government code. Made me so mad. Like, why didn't you just rewrite it and leave it there? Why did you have to delete that entire chapter and create a new one? But they did. So the general rule is records of a public agency are public records. Now, you guys are hospitals, so all the exceptions swallow that rule. And most of your records are not public records. But there are some, things more administrative, things that are board related, financial, as long as it isn't dealing with a specific patient, those are public records. Occasionally we get requests for public records. Where we really see it here is on the public works projects, because it's the unions. We want to make sure we're following the laws and the prevailing wage laws. So that's the most frequent type of public record request that I see. Although sometimes they'll want financials or whatever. But most of them we just say, well, they're posted on the website. All you have to do is go look at the agenda packet. And they're the monthly financials for the last 10 years. So, so that's as we go more and more online and the websites become more sophisticated, that's less of an issue. The public works is a bit, and I expect once your project really gets going that we'll see some of that. Destroying records. There are timelines for how long you have to keep them. Some are in perpetuity, minutes, real estate records, litigation records, you have to keep for forever. Others you can destroy after certain statutory periods of time. To destroy a public record, I have to approve it. and then the board has to approve it. And so we all have to sign off on that. So,
Real estate workers, you don't have to keep them. For your benefit, you have to keep them.
no, real estate transactions, public agencies have to keep it.
Oh, public, I'm sorry, okay.
So these, yeah, just the public records, just the district records. And for personnel, like you go into Transparent California, you see what everyone makes, and maybe it's a couple years old, but all that's public. So you can't hide that, and you can't hide it behind employee numbers or job descriptions. There's a case out of Alameda County where a paper asked a police station or sheriff's department for everyone's compensation. And they asked for it by name. And the agency said, no, we'll give you the job description, Sheriff's Deputy 1, Sheriff's Deputy 2, and the amount. We're not going to attach their names to it. And it went all the way up to the Supreme Court. The Supreme Court's like, no, you got to give out the names. So.
That was California.
Fair processes, you're supposed to be unbiased in what you do. The general rule for this is if it's your worst enemy or your best friend, you may want to recuse yourself. That would be what you traditionally call abstaining. We have a lot of disqualification, which is different than abstaining. Because in abstaining, you still count towards quorum. But if you disqualify yourself, you don't. So there are certain times when you abstain, certain times when you disqualify yourself, or certain times when you just, you don't say anything. So obviously you'll have biases in the decisions you make because everyone, I mean, unless you really just don't care, but everyone there's something that forces them to vote one way or another. That's okay, right? That's to be expected. It's when it's like, oh, this is my best friend. They really need this. We should do it for them. It's not the best contract for the district, but this is the person, right? And it's like, all right, well, how biased are you? Or it's, man, I hate this person. Yeah, I don't care that they run a good business. I don't care that it's the best price. I don't care that they're efficient and they'll give us a good deal. I just hate them. So you go with someone else, right? In those cases, you should probably.
Sounds like Stormy Daniels.
There you go. I haven't seen a moment of testimony, but there you go. So what are some crimes? People cannot pay you to be appointed to office. So if one of you stepped down, resigned, you're moving or whatever, the rest of you who are on the board, you can't accept payment to appoint someone to that position. Okay? Someone cannot pay you to perform official duties. So let's say you're at an official ribbon cutting event. Someone says, hey, I'll pay you $1,000 if you let me cut that ribbon. You really can't do that, right? All right. Now, if someone wants to donate, $1,000 to the district, well, that's okay, but you can't get the money for it, right?
So much for that trip to Vegas.
I know. You can't embezzle funds. You can't misuse public funds, as we've discussed. Disclosing confidential information received in the closed session is a misdemeanor. So there are some crimes that would attach to conduct as a public official. Incompatible offices. You can't sit on the board of an agency that would have a conflict with the district. Typically up here, you would think that like if you had a water district with a water board, because they set the water rates. And if you're on the board for the water district, you want to maximize water rates. If you're on the board for the healthcare district, you want to minimize water rates. So that presents an inherent conflict of interest. So that would be deemed an incompatible office, but you never know what's going to happen. So I had a director who was on a school board and a water board, that exact situation. She was sued. We said, this is a clear incompatible office. And if there's ever an incompatible office, this is it. She's like, maybe. I really liked her. She was just as funny as can be. And she was a really good director. And so she's like, but my term's up in the air and I'm not going to run again. So I'm just going to run out my term. And like I did all the research on it. And I'm like, I hear you, but if you get sued, you're probably going to lose. She's like, okay. And there's a director who everyone detested, who was sent numerous employees out on workers' comp for stress leave because this director was always in the office looking over their shoulder, harassing them. And so she sued. So this is incompatible office. We're like, oh, such a bummer. So they lawyered up, went to court. All the attorneys and the judge are like, this is clearly an incompatible office. Well, it's a jury trial. The jury came back and said, no, that's not incompatible. And we're all like, what? If that's not incompatible, there's no such thing as an incompatible office in California anymore.
But they understood who she was and what she was doing. And they used the common sense and did what was right.
I think so. I think so. And maybe it was because she had less than a year on her term. But I mean, we were all happy with the outcome. That director was
surprised.
She was great, but we're like, wow.
The other one had to pay the fees.
No.
The other one who did the suing, they didn't have to pay lawyers' fees.
They each paid their own fees. But I apologized to the director. I'm like, look, all the case law, and she was a good sport about it. She's like, I know. It was just a crazy jury. Yep. So you never know what you're going to get.
Or a good jury, depending on how, it sounds from what you're saying, they did the right thing.
They did. Competitive bidding, there are things that you are required to competitively bid, including public works contracts. Materials and supplies of $25,000 or more, except materials and supplies used directly in patient care. So gurneys, wheelchairs, bed sheets, gowns, medications, things that patients use every day are not subject to that 25,000. Paper, toner, fertilizer for the lawns, those things are not patient care items. $25,000 or more has to be publicly bid.
X-ray machine, would that be, that they don't use it every day, but
it's patient care. It's a patient care item. Surgical equipment, all of that is directly related to patient care. For IT, if you are purchasing anything related to data or telephonic equipment, goods, or services, $25,000 or more has to be bid. So this can be an issue because you get software systems. And those software systems are more than $25,000, but you have a preferred vendor, right? Well, you can't sole source it. You do have to do an RFP process. So you can lay out the specs for what you want, and you can go to your preferred vendor and say, here's the RFP, please submit a proposal, but you can't sole source it. So that's kind of a pain for healthcare districts, and that's exclusively for healthcare districts. Architects and engineers on your projects, you have to have a fair and competitive selection process. Construction managers, environmental consultants, surveyors, landscape architects, and engineers. It's just an RFP, right? So you send it out to 3. They are all submitting their proposal based on the same documentation and same information. You choose the one in the best interest of the district, which may include a cost component, but unlike public works, it's not the lowest bid. It's the one that's in the best interest of the district. Public works is lowest bid. And then the last item we have to cover is nepotism. So can family members work together at the same agency? Yes, they can. Can one supervise the other? No, they can't. And I had a call literally on the way up here today. I had a call from one of my HR directors, and one of the other directors in the agency wants to hire her son to work in his department. She's like, well, can I do that? I said, well, you two are peers, right? She's like, yep, I'm a director and he's a director. I said, yes, you can do that, but you have to put a wall around you. You can't take any role in hiring, firing, promotion, demotion, compensation. or discipline. Right, so the director is the next level up, CEO. I said, so you're out of the loop on your son now. And it goes from his supervisor to the CEO. And if you structure it that way, you're okay, but you can't have any influence over the conditions of his employment. And that's okay. And as we all know, husbands and wives can sit on the board of directors. And that's not a violation of law either.
Corporation I grew up in. As soon as I went from being a grunt to a supervisor, my father was GM. I was instantly transferred to another division. No BS.
No.
You're out. No, yeah, no, unfortunately.
Well, can board members get married?
They can.
Gene, do I need to know anything?
Board members and employees can get married. Right, there's no, but you just have to isolate the one who's in the higher position. So you don't run into these issues.
Don't run into those issues. I
Told you I registered for a non-op.
Right.
Any questions?
That's a lot of information.
It is. So it's 19 laws in 2 hours, 6 minutes per law. And some of these laws, just one law you could spend 2 hours on.
Yeah.
With all, so thank you for saying that, because this gets back to what I said last month. If there is an item on the agenda or something related to the district that you become aware of, that you think you may be involved or may affect you, call me right away. If you don't become aware of it until the meeting, then that's fine. Then in the meeting, I might say, let's table it till next month so we can work this out. But as soon as you know, let me know. And I try and have Tim and Heidi and others keeping an eye on agenda items and whether or not they may personally involve any of you. Because it can be very embarrassing to be in a board meeting and say, hey, Scott, I may have a conflict here. Right, because then the public's like, oh, it's this.
Ooh, a conflict.
Yeah.
Yeah.
Oh, let's stay tuned.
And so we don't want to do that, right? So I mean, if sometimes you don't have any idea until you're in the meeting and then you hear what it's about and you're like, oh yeah, that may be a problem. And then I'll just say, all right, well, let's just table it till next meeting. We'll take it up then. But yeah, just keep an eye on your agendas. You guys see stuff coming through committees. Okay. So look, the rules that apply to board meetings apply to committee meetings. So you can't participate in a committee meeting if you can't participate in a board meeting, but you should have a heads up if it comes to a committee. And keep an eye out for one another, because you don't all sit on every committee. So if you're keeping an eye out for one another, you've got Tim and Heidi keeping an eye out for you. Hopefully we catch most of this stuff before it ever becomes an issue.
Yeah, well, just real quickly on the subject of committees, I know we kind of had a little issue with me being out of town and calling in.
Mhm.
I know this particular committee is usually a closed meeting.
The med qual one that we called you about.
So, and that's a very rare situation, which probably won't ever happen again, so I'll be on board. But how do we have to remedy that by still putting my location on the agenda, or?
Yeah, so the agenda requirements for committees, any committees are the same as. So the only one that you guys do that is weird to me is building and planning, where you run it as a joint. It's not really a joint committee, special board meeting. It's really just a special board meeting.
Let's
And
start it out as a subcommittee, but because all of the board wanted input on the project in general, one of the board members suggested making it to where everyone could participate. It was Kate.
Yeah, and I don't even, do you even appoint two directors to building and planning?
No, it's just a special board meeting, basically.
Yeah, so you don't have building and planning that meets. So that's kind of I've complained to Heidi about that. I'm like, I don't understand this. So
It's like another board meeting, so we got an agenda, it's gotta be, everything is gonna be talked about.
Yeah.
Yeah.
and you posted as a special board meeting,
Yes,
but you call it a joint
yes.
building and planning special board meeting. Well, you don't have committee members for building and planning. So why would you have a committee meeting?
When we
If
first
you
started
did
the
it like-
committee, we had board members that were appointed to the committee.
well, as I recall it, didn't it start every other month? One
At
month,
quarterly.
it would just be the committee, and then the next month, or it would be the full board. And like, if you did it that way, then that makes sense, because you have a building and planning committee with 2 designated directors. Right, and then every other month or quarterly or whatever, the full board meets. Okay, that makes sense to me. But calling it the joint building and planning when there's no building, just drop building and planning, or go back to how it was before. In some months, it's just the committee, and some months it's a joint meeting of the committee and the full board. So, I mean, that's up to you, what you want to do, but if you're going to keep it a special board meeting every month, then let's drop building and planning.
Even if it's just always specifically just about building. Well, actually, there's sometimes where there's not subjects related to both.
Every once in a while, we'll throw in like an agenda item if it's something that has to be, like action needs to be taken timely or quickly.
Yeah.
Then every once in a while, we'll throw something else on there, but then it like kind of gets lost in the mix and it's hard to find it back in the minutes. And so we try to avoid doing that whenever we can and just keep it strictly building related items.
Yeah, and I don't want to change it right at the moment because we have a deadline coming up July 1st. I want to see it's gonna make it. That's, yeah, that's just my,
What's July 1st?
to have administration building going on and stuff. Certain things being,
Oh,
All right, so you have now done, I think, 2 hours and 15 minutes of ethics training.
Yeah.
Yours gets to you.
can you tell if
Still have
I
to adjourn if we're
soaked
done.
it in?
Actually, you slept
How
through
many
half
years
of
have
it.
you done it? I mean, you could give it.
Gene, you could get it, but you slept through half of it, so you need another hour.
Yeah, but half of it, I did. That is so cool.
okay, I'm gonna call the Board of Directors meeting adjourned at 4:42. Thank you.
Thanks all.